Hi, my name is Rachel Knight. I'm assessing my 8-year-old son, Paxton. So I will initially wash my hands, introduce myself, and tell the patient what I'll be doing today. And I will immediately start assessing the patient for if they're in any distress, if they look disheveled, if they're clean, their hygiene, if they're breathing normally, just their basic physical appearance. And so I'm going to go ahead and start with Paxton. And he is sitting here calm and he is in no distress at all. Paxton, can you tell me what your last name is?
Knight.
Can you tell me what month it is?
October.
October. Okay. Do you know who the president is?
Joe Biden.
Joe Biden. Okay, good job. All right, so I'm going to go ahead and start assessing his head and his neck. So I'm making sure he is symmetrical, his eyes are symmetrical, his nose and his ears are all the same size. Everything is symmetrical from the midline. I'm going to go ahead and start palpating his lymph nodes in front of and behind his ears. I'm going to check for his thyroid gland and see if there's any kind of swelling or edema. And I'm going to look for it too, along with palpating. I'm going to feel these lymph nodes in the back of his head and his neck, and then around the collarbone. This can be ticklish sometimes for some patients. So we check all of those lymph nodes to see if there's any kind of swelling. And I'm going to look at the trachea and make sure it is midline. Okay, so we've checked all the lymph nodes, the pre and post ocular, the submental, the submandibular, the occipital, the superficial, and the deep, cervical, supraclavical. Okay, and now I'm going to listen to his bruit, his carotids, to see if there's any bruits, any thrills, and I'm going to listen with the bell of my stethoscope. Go ahead and turn your head this way to your left. Hold your breath. No bruits present. Now turn your head to the other side. Hold your breath. Okay, no bruits present either. Okay, now I'm going to start his facial assessment, and I'm going to be assessing many things at the same time. I'm going to go ahead and start assessing some of the cranial nerves along, with his eyes and his nose and his mouth. So I'm looking at his eyes to see if they are, the pupils are equal, round, reactive, and accommodate. I'm also going to check his line of vision and check for his cranial nerves. So I'm going to start with, I'm going to ask him to smell something, a piece of lemon or something like that, cinnamon, and ask him to smell it and identify that. And then I will test his peripheral vision. I'm going to have you cover your left eye.
Wait.
Just cover one of them, okay.
Yeah.
And then I want you to follow this without moving your head. And I'm going to test his 6 gazes. So here, just follow with your eye. Same with your other eye. Good, and he did that good without moving his head. His eyes were not jittery or twitching. Now, I also have the Snellen chart. The Snellen chart, he will do standing at 20 feet away, and he will read the line lowest that he can read. So we will do that in a little bit. Okay, so I'm going to go ahead and look into your eyes. I don't have a ophthalmoscope, so I'm just going to use my otoscope with the light and check his eyes that way. I'm looking at his red reflex to assess any kind of abnormalities with his retina, if there's any detachment, any kind of blastomas or anything like that. So what I do is shine from away and see if there's a red reflex. Look straight ahead. Okay, and his red reflex is positive. Okay, and now I'm going to check into his ears, and when I do, I'm going to be looking at his auditory canal, his tympanic membrane, and I'm ensuring that it is pearly gray, that there are, the cone of light is in the correct position according to which ear I'm looking in. So I'm going to pull the earlobe back and maybe down up a little bit and look into his ear. I'm looking for those landmarks and any erythema, any bulging. And his ears are negative for any bulging, any redness, any drainage. They are pearly gray. Now, can you open your mouth for me? Say ah. Okay, and I'm seeing that his palate is retracting with the phonation. His lips are pink and moist. His tongue is moist. There are no lesions. There's no ulcerations. His teeth are all intact. He is missing a couple teeth, but that is normal for his age. His uvula is midline, and his soft palate rises symmetrically. And I'm also testing his cranial nerves at the same time. So I want you to, I already did your 6 gazes. I did your peripheral vision. We did the Snellen chart. So I'd like you to clench your teeth. Okay. Close your eyes real tight. Good. Okay, smile for me. You can open your eyes. Smile. Okay, puff up your cheeks. Puff them up. Good job. All right, now, can you cough for me? Okay, good job. Now push up against my hand. Any pain?
No.
Okay, do it again. All right, now shrug up against my hands. Push your shoulders up. Okay, good job. Stick your tongue out. Go side to side with your tongue. Okay, good. I have checked all of his cranial nerves. Now I'm gonna, while he's sitting up, I'm gonna just kind of inspect his chest, make sure it's symmetrical, make sure there's no crepitus. I'm gonna go ahead and listen to all of his lung sounds. With the diaphragm of my stethoscope. I'm going to listen equally to both sides. And then I'm going to listen in his back. Same way on both sides of his back. I'm going to go ahead and listen to his heart, check for any murmurs, and listen to his S1 and S2. Okay, I'm listening to your aortic valve, your pulmonic valve, Erb's point, your tricuspid, and your mitral valve. There's no murmurs, no splits. S1 and 2 is present. There's no S3, no S4. Now I'm going to go ahead and check his pulses, his carotid, just one at a time. not at the same time. Check his carotid, his brachial, his radial pulse, his femoral pulse. I'm gonna get behind your knees here. Your popliteal pulse, post-tibial pulse, and pedal pulse. Okay, go ahead and scoot back a little bit. They're all regular, strong, +2s. Very good. We're almost done, Paxton. You doing okay so far?
Yep.
Okay. All right, go ahead and lay down for me, like you normally would. I'm going to go ahead and inspect the abdomen. Scoot a little closer to me so I can reach it. So I'm going to make sure that everything is symmetrical. There's no obvious masses. And then I'm going to go ahead and listen to his stomach in all 4 quadrants. Make sure his bowel sounds are active and not hypoactive or hyperactive. So I'm starting in the lower right quadrant and moving up to the upper right quadrant, upper left, and lower left. While I'm at it, I'm going to go ahead and check for bruits in his arteries with the bell. I'm going to listen to his aorta, his renal, iliac, and femoral arteries for any bruits. There are no bruits. And then I'm going to percuss. There's no dullness. There's no tympany. Now I'm pushing to check for the liver, the size of the liver. It's not enlarged. The spleen as well. Neither are palpatable. Okay. Go ahead. I'm going to check your extremity strengths. Go ahead and squeeze my hands as hard as you can. Squeeze, squeeze, squeeze. Good job. Okay, let go. All right. Now I want you to push up against my hands as hard as you can. Push, push, push. Good job. Very strong. Very strong. +5s on his strength. I'm going to go ahead and check his peripheries. There's no varicose veins, no any kind of edema, no peripheral, no lymphedema, no type of pooling of blood. His color looks good on all of his peripheries. His deep tendon reflexes, I'm going to check those. I don't have a hammer, but I will pretend. So, okay, go ahead and sit up for me, back up on the side of the bed. Okay, and now I'm going to check your reflexes, your bicep reflex. So I will take my hammer and I will hit here, tap here for a reflex on both sides. And then I'll also do that was his biceps, and then I'll do the triceps, brachioradialis, okay, patella, just rest your leg, nope, relax it. Okay, there we go, got to jump, there we go, good job. And then we'll do his Achilles. Okay. All right, he was symmetrical on a scale of 4-4. All right, now I'm going to assess his gait. I'm going to ask that he just stand up. I'm going to go ahead and do the Romberg test when he stands. So Paxton, go ahead and stand up. I want to make sure that they can still see you here. Face this way. Can you close your eyes and just stand? Now this is assessing for procreation, and he can close his eyes and still be stable, and there's no wavering or balance issues here. Now Paxton, I'm going to ask that you walk to the camera and just walk right back with your eyes open. Yeah. Okay. his gait is steady and strong. All right, go ahead and sit back up here. I'm gonna look at your feet. I'm gonna look for your skin integrity. Make sure you don't have any ulcers, no wounds, that you're healing. Your toenails are clean and clipped and not digging into your skin. And there's no deformities. There's nothing wrong with his toes or his feet. Okay, that's it. Thank you so much.